Welcome back to New to Medical Device Sales. I am your host, Jacob McLaughlin, and today, you guys, I am so excited to be bringing you guys a true expert. And I truly mean that. Today, we have the pleasure of having somebody who's been in the pharma and medical device sales industry for over 24 years. They've been a rep, they've been a manager, they're an author, a speaker, a consultant. They have 9 kids, so you know that they're able to handle some chaos and be responsible. So today we're so thankful and grateful to have Jason Elmore on today's show. So Jason, welcome to the show.
Thanks for having me.
Yeah, no, I appreciate you just taking time to join us because your resume says it all, and we'll dive deep into that. But again, you just have so much experience, and your content that you put out is so great and so helpful. And so I just feel honored to be able to have you today because I know the listeners here today are going to get so much value from you because that's really what you are. You're a walking book of value.
Right on. Well, I am excited. When I first heard that you existed and what you were up to and how you were trying to help people break into med device, um, that got me fired up. For me, um, my story is a little more personal, and so I don't know where everybody that you're talking to comes from, but when I was 6, there were two things that kind of happened. We moved from the country. We lived in a mobile home out in the country, and my dad got a job, and we moved into town. That same year, my mom, who you see pictured, was diagnosed with cancer, and she fought a 9-year battle with cancer, and then she died. A lot of the developments, a lot of the innovations, a lot of the technology that we now have would have saved her life. But as you can imagine, as a kid, there was a piece of me that, when I went to bed at night and said my prayers, I was praying for the gift of healing. Now, for me, I'm the son of a coal miner, very blue collar background. I was one of the first kids in my family to go to college. Med tech, med school just was not in my future. Sorry, med school was not in my future. A little bit of a late bloomer. But when somebody came along and said, "Hey, I see what you can do. I see what you're about. You should take a look at this." And I was like, "What? You do what? You go in the operating room and you what? You help surgeon? You what?" Just, but you talk about lighting a fire, right? There was already this personal situation that kind of, I was desperate to help people feel better, get over diseases or injuries or whatever that was. And so when I found out about med tech, I was so excited. So if your audience is saying, yeah, I've heard about it, I've got my reasons, I'm passionate about patients. The note that I put out to LinkedIn yesterday was kind of also telling. I love LinkedIn. I love the people that do med tech, but I'm kind of tired of seeing people with a surgeon who's holding their product. Like, listen, I do want them to succeed. I do. That just doesn't work for me. Like, don't show me that. Tell me about the patient. What did your product just do for the patient? Tell me that story. Now I get fired up about that. Is that fair?
Yeah.
Or when you finally get the job, when you finally break into med tech and you're on the sales side, you're going to get a quota. And so sometimes when I'm training or I'm leading events with salespeople, I'll ask them, "So what would it mean if you missed your quota?" And the answer I get most of the time is, well, I wouldn't make my money, or and what I'm trying to help them appreciate is like, no, 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 no. If you don't hit your quota, that means how many patients didn't get relief from your product? Like, somebody got their face ripped off, or something, like, because some of the older technologies that you're replacing are a little barbaric.
Yeah. 100%.
The opportunity to make things better is serious. Like, that patient is going to have this, and this if you don't win tomorrow. If you don't convince that surgeon to use your device, then it means this. Ugh. So, yeah,
I
properly
just
motivated.
I just want to touch on that. That is so good because that I actually literally just had a talk with somebody in our sales course about that. To that exact point, is a quota is just the impact that you're having on those patients' lives, and everybody, again, in med device and med tech, you and I both know this. Yes, you can have a nice career, you can make good money, and we all know that. But everyone will a lot of times be like, "Why are you so good?" Or like, why are the top reps so good?" And I think it's because, to your point, they know the more people they're helping, that's what drives them. That's what gets them out of bed. Because if we're just going dollarly cost average, a lot of times it's not going to be worth it. But when you have a bigger mission of beyond yourself and the impact that you're able to have, that makes you worth it to go do it and know that you're providing that much value. And like you know this, and we all know is the amount of money you make is just the amount of value that you provide
Right.
to the market. And so I just love that you said that.
Right. So you thought it would be helpful for your audience if they knew a little bit about my career path. So
Yeah.
yeah, but it's a great question. And it's going to come back in like a part B here in a second in terms of how I counsel other people who are coming into the industry or just making job moves, right, in the industry.
Yep.
For me, went to college as a marketing major, and coming out, we had a lot of companies coming on campus recruiting. And I got one piece of good advice, and that was pay attention to their training. So, Northwestern Mutual Life Insurance and some manufacturing businesses and, some other more glamorous, sexy things, working on Wall Street and some things. But Brian Bagheera came on campus from Cintas Corporation. It's like, hey, sell uniforms to gas stations and coal mines and like shop rags. And I was like, that's not sexy. But this cat came on campus with a 6-month syllabus. Cintas had a management training program where they were making hundreds of millions of dollars at the time, not because they had, sexy shop rags, but because they had this tremendous internal development program for leadership. And now they're multi-billion-dollar industry company. But I was so impressed. I was just blown away. Like, he could tell me where I was going to be every day for 6 months, what the training was going to be and what it looked like. And that was super impressive. And it turned out to be the exact right answer. And that's what I would tell your team and your audience is you're looking at your job opportunities, pay really close attention to the training. It's going to have a huge impact on your future success, your career tenure. So one of the things that I focus on as a director of sales training and learning development for 4 companies over the last 12 years. One, I got to address some frustrations I felt like when I was in training. I like, this could be better, right? That was part of the motivation was like, could we make this better? But I learned a lot as well, right? Adult learning concepts and best ways to do things, and which led to the book, right? So I wrote a book in 2017, Elite Execution, that was coming out of that experience of being the director of sales training. In my classroom, we had as many as 16 people at a time. In the course of 1 week, they would do as many as 10 role plays. Well, that's 160 sales calls in a 4-day period. That's a beautiful little laboratory where you can see what works and what doesn't work. And that's what led to the book, was not stuff that I created so much as stuff that I observed, like, ooh, that's good.
Yep.
Ooh, that works. Ooh. And I'm a big fan of the Challenger sale, and Adamson and Dixon say the same thing. Like, they didn't create Challenger methodology. They observed it. They said there are people who are winning here in the financial crisis of 08, 09. What are they doing? And they just went and observed it, right? And if you know Challenger, they've continued to stay on the research side and have pivoted and developed, and now they have sense making, some other things. So if you're not paying attention to their most recent stuff, you're missing it. But one of the things I would tell your audience is, really quickly, they're going to have to understand the difference between success and failure is going to come from confidence. And one of the ways that plays out is the difference between being aggressive versus being perceived as assertive. When the rep comes in and she hit her quota at the beginning of the month, and here we are at the end of the quarter, and she's way over, she walks in, she's confident, right? And she's perceived as being assertive, as opposed to the same rep who walked in earlier that morning. She's $100,000 behind her number with 2 days to go.
Yep.
She's desperate. And it comes off as aggressive. And the only difference is confidence. And so, as a trainer over the years, and what I preach to training people I work with is, your whole goal as a trainer is to build this person's confidence. They've put their career in your hand, their ability to provide for their families and build a resume and all this stuff, right? Like, your goal is to give them confidence because it matters, because it gets perceived in the field by customers. So whether that's the right sales tools, right clinical data, good product, good procedures, um, it all matters. And so as you're looking at opportunities, really pay attention to the training. It's probably going to make the difference when you get out in the field.
That's so good.
So, to that end, um, went to Cintas, had a friend come along about 3 years into it and say, hey, I see what you can do. I see what you're about. You should take a look at this pharma thing. It's a company car, it's a salary, it's a
Pretty
professional.
good, pretty good gig.
Yeah, so I was in, right? And got that job. About 2 years into it, we were right in the middle of the arms race. Pfizer and other companies were just loading up on sales reps and diminishing the value of sales reps in that space. And it was unfortunate what happened there, but that's how I knew it was time to go. When I started not being valuable to the people I was calling on, I was miserable, just miserable. But I had somebody come along and say, hey, I see what you're about. I see what you can do. You should take a look at this. I was like, and that was the whole thing. Like, what? You can do that? It was med tech, right? And my first interview was with Synthes Trauma, and I went into the case, and there was a guy on the table. He got hit by a bus earlier that morning, and he had broken his leg from the knee down, just clean break. His ankle was just dangling there. It was gross. And they were putting a tibial nail in. The doctor's like wailing on this tibial nail, and I could not stay on my feet. I barely made it out of the room and like collapsed in the hallway. The first OR experience, like, was not good. So I ended up not taking that job, and I admire people who can do trauma and that schedule. But long story short, got into an entry level kind of marketing program with Kaifon, then got into an entry level OR rep consultative job with Johnson & Johnson in sports medicine, and then got a call from a recruiter. He said, hey, there's this tiny little company, don't know if you'd be interested, but it's calling on ENT. The device is used with the endoscope in the nose and the sinus space, and it's a balloon that moves bone. Well, in my pharma days, I had sold allergy and antibiotics to ENTs and allergists. So that was my call point. When I went to Kaifon, that was a balloon that moved bone in the spine. And when I went to Johnson & Johnson in sports medicine, we were doing arthroscopic shoulders and knees. So it was all under the scope.
Yep.
Right? So ENT, balloons that move bone, scope. I'm like, dude, I'm perfect. You got to give me this interview. I'm like, this is yes. And there's a great story there. Long story short, I was desperate. There was a desperate situation. This was just perfect. But so I would tell your people, like, you kind of want to look for that.
Yeah.
If you know the story of David and Goliath, you know that before Goliath, David had actually fought with a bear and a lion. And what I've seen and what I look for and what I tell people to look for is God is very gracious and he's very kind, and he gives us a bear and a lion before he gives us the Goliath. And so you want to look in your career and you want to see, what is he given in your career path that prepared you for this next thing. And if you can't see it, you need to be very, very cautious and very wary. And like, I don't know if that's the one, right? I kind of need to see this thing because it matters. And you should be able to see it. And many times we do, right? And if we don't, then I give some other counsel. But you want to see that. Did you see that in your career path?
100%. Like, so I've always said this. It's like, again, I'm a man of faith too, but I always laugh about like the Lord works in mysterious ways.
Absolutely.
And I always joke around with people as like he knows what he's doing and he formats, because like even like for the format of like people would always talk to me, hey, you're a personal trainer. That doesn't relate at all. And I was like, actually, it relates a whole lot, because here I was able to say, hey, I'm already working these long hours. Here I'm already able to work with doctors, CEOs, like these top executives, get to know them actually relationally before I ever had to actually go into medical device sales. And so to your point, I was able to do it. And then even during that journey of going into medical device sales, I just actually had a talk with somebody. You get multiple job offers, right? Like, for example, I did, and I was very fortunate. I had to pray on those because, some of them you have peace, some of them you don't, and you're like trying to walk through that. And to your point, when you look back at what's happened in my life to get me to where I'm at right now, that was a big journey. And like, especially where I'm at right now, like to just be transparent, I go into GYN and I'm like, hey, where's this going to kind of take me? And now I'm with a company that calls on GYN and general surgery, right? Like like you said, it was the perfect. And I was like working with products that I actually used to sell. And I'm like, I get this. This makes sense. And it's
Yeah.
that step before.
Yeah. So if people are jumping out of one industry into med tech, it's a big jump. You want to look for some clues that maybe, you've had a chance to prepare a little bit. And then once you're in med tech is you're jumping spaces, right? So I went from ENT, sports med, spine, urology. Those sound very disparate, but there actually was a thread and there was a reason why those things went very well.
Hmm.
So to your audience, important to note. The other thing is I want to put everybody back on their heels a little bit. It is an awesome job, okay? But think about it this way. Changing human behavior is tough. Okay, that's just sales, changing human behavior. That's tough. Persuading another person, in this case a surgeon or a physician, who's your superior on pretty much every level. They got more education than you, more prestige, more letters behind their name. They probably make more money than you, like name it.
Yep.
Okay, that's exceptionally challenging. Now do this. Persuade this doctor to take your innovation, put it in or on another human being who's entrusted their life or their care to them. They're going to go against all their former training. They're probably going to go against their academy or their accrediting body, right, that has guidelines on stuff like this. And depending on how startup and how new, and innovative it is, it probably doesn't have coding and reimbursement yet. So they're going to do all of that and take a chance on not getting paid.
Yep.
If you wonder why startup med tech reps make so much money in our industry, that's why. Because the challenge is off the charts, right? That's amazing. If you can do that, like, yeah, you should get every dollar they give you. Okay. But I do want to like put people back on their hit. Like that is what we're asking you to do.
100%.
And so as we go through this next, segment, bear that in mind. That's what's up. That's why we're saying like read good books, get good training, talk to smart people. There are things to know, and this is going to be quite a challenging job.
Yeah. It's no walk in the park, we always say.
Right. All right. So let's pivot. As you and I had discussed, there are some things I want to give your audience. I just want to bring value to them. And one of the things that I want to give you is on the screen right now. Can you see it?
Yeah. Yep. We're good.
All right, right on. So there was a point in my career where I was working with clinical specialists, and a lot of the entry-level opportunities right now are to have you be an associate rep or a sub rep or a situation where you're not running a territory. There's a senior representative who's running that territory. You've been added as a resource to them, and you've got a role to play, right? And that's super challenging because, frankly, a lot of med tech reps are reps because they're not good at managing other people. And maybe they're not good at collaborating with other people. So if you run into that situation, give me a call. I can give you some pointers on that one in particular. But at one point, I had a situation where I had 5 or 6 clinical specialists covering cases for me. Right. So a lot of the entry level positions are this kind of clinic rep where you're going to come in, you're going to cover my cases. Okay, great. And that's going to be an awesome opportunity and awesome experience. But there are some things that you should do specifically. How do I cover cases? How do I go in to this OR? So this is what I call investigate, articulate, celebrate. 3 things that you should do every case you cover. So when these people would cover cases for me, they knew that at the end of the day, they had to call me and that I was going to ask them 3 questions. Tell me about the patient. Tell me about the case. And tell me what you chose to celebrate. Those were the 3 things. Now, what do I mean by that? Well, when I say investigate, I need to know male or female. What was their age? Did they have any previous surgery? What were their chief symptoms? Any other concomitant diseases? What medications were they taking? What were their test scores? Like, I need to know about the patient. So when you walk in the OR, I want you thinking the doctor's thoughts after him. I want you to become part of the treatment team. I want you to come in and ask these questions, because you know who asks these questions when they come in the OR? Other doctors. Other doctors. You could be that person who comes in the OR and says, "Hey, how about them Steelers?" You can, hey, if you want to be that guy, you can be that guy. I don't recommend you be that person. Okay. Now, on the flip side, here's the way it works. So that person covered 4 cases for me today. And that device is indicated for patients 45 and older, male and female, with a liver size of, X to X gland size, whatever. Okay. So like, yeah, 4 patients, great day. Cases went well. Tell me about the patients. Well, we had a 72-year-old gentleman with 100 grams something or other. You had a 74-year-old male with 100 grams something or other. You had a 69-year-old male with a 65 gram something or other, and you had a 80-year-old male. Okay, but my indication is 45 years and older, and it's 30 to 100 grams. And so I'm all excited because I got 4 cases today. But because you asked the right questions, I now know that surgeon is not comfortable with my full indication and isn't using it to the full indication. And his patient selection is not nearly where I want it to be. I got 4 cases today. I should have had 10. See the difference?
Yep.
This is how you find out you're getting niched. Okay. So it's super important information. It helps you be part of the treatment team so that later in the case, when you're advising them to use more of your product, or something, another version or another screw or whatever it is, you're not upselling.
Yep.
You're part of the treatment team because you ask the right questions at the beginning of the case. You're treated differently.
Yep.
Now, the other thing is this: there will be some things that go on in this case that, because you ask me these questions, you're not having the wrong reaction or you don't lose credibility. So for instance, let's say the patient was on Eliquis and they took him off Eliquis 4 days ago. Well, Eliquis is a blood thinner and it takes 7 days to wash out. So you're going to have a bloody case. And if it's arthroscopic, you're going to have trouble this whole case because you can't see. And there's things like that where you kind of need to know, because they're impacting your case and they're impacting your product and they're impacting your procedure. That if you ask the right questions, you're not the idiot in the room going, "Wow, man, it's a lot of blood. I wonder what's going on." And like, you're not panicking, thinking the patient's dying. It's like, no, the washout period wasn't enough. Like, it's those kind of things. Like, okay, number 2, tell me about the procedure. Tell me about the case. I believe in something called verbal technical assistance. There is a very concise, very precise way to articulate your procedure, and you better have it. If you're giving a surgeon guidance, if you're consultative on application of a product, you better be nails. And it better be concise, like as few words as possible.
Yep.
Very precise use of terminology, and your ability to articulate the anatomical structures and the orientation, and like, it better be pretty impressive. Like, I'm horrified sometimes at what I hear in the OR. "Hey, go up just a little bit, up just a little bit." That has a lot of different meanings in an OR setting.
Yep.
All right. So enough with that. Hopefully your product and procedure training's spot on and you're pretty sharp cat and you know that stuff is important. Finally, celebrate. You need to choose something that made this case go well. Answer the question. The reason this case went so well is, now that might be ergonomics, it might be methodology, it might be the precise way they articulated the devices. Doctors love to be told they're precise, they're methodic, but maybe your device enabled them to do that in half the time. Were you tracking the time? Like, did you call that out? Did you celebrate? "Hey, dude, this used to take you 90 minutes. We just did that in 37 minutes.
Yep.
or look at the blood loss, or look at the, like, you preserve that tissue, you preserve that anatomy, or like, celebrate, let's get excited because I got news for you. The nurse was looking at the screen and all she saw was pink. The anesthesiologist was checking his stocks on, he didn't even pay attention.
He was sleeping half of that
Yeah,
time.
he wasn't even paying attention. Like, everybody needs to get excited, especially if you have new technology. And this is the first case ever done in this hospital or in this county or in this state.
Yeah.
Like, you need to be celebrating. Now, here's what you want. When you're not there, the day you're not there, you're driving down the road and you get a text message from a surgeon. Today was the day he was going on his own. He shoots you a couple pictures you're not allowed to have because of HIPAA. He says, hey, look at this. 4 millimeters, 20 minutes. Like, okay, why is the surgeon sending you a text message with that information the day you're not there? It's because you're the only person who can appreciate what they just did. They know, and they want that celebration again. They want that stroke. They want,
feel good.
Yeah, the camaraderie and this team thing that we developed. Like, yes, and they want somebody else to know what they just did. Because listen, you celebrated after that case. She went home, and the kids were waiting, and the dinner needed to be done, and the laundry needed folding. Like, nobody knows what she just did. You don't know what I just did. Like, nobody knows except for you. And if you missed that opportunity to celebrate, you missed a huge opportunity.
Yeah.
How was this different? How was this better? What did it mean for the patient? Like, did you take pictures? Did you put it in the chart? Did you show the family in the waiting room? Like, celebrate, get excited. Right. But I will tell you this, and that's the quote at the bottom of the screen from John Larson. The greatest benefit from the ability to distill customer loyalty into a few easy to understand behaviors was also the biggest drawback. It made the execution of such behaviors seem trivial. In most cases, easy is extremely difficult to achieve on a consistent basis. You got to do this every time. If you want the text message, this has to be true of you every time. It's going to make you a better consultant in the OR. Literally, it's going to make you a better med tech rep. Okay. But if you're entry level, then the way this looks is you, in a brief email, put these 3 things for every single, all 4 patients, and you shoot that email to your senior rep, and you're like, hey, covered your 4 cases today. Here's what happened. Here was the patient information. Here's how the case went. Here's what I chose to celebrate. You send me that email. Oh, we are, dude, I would love you.
You trust them.
Yes. Now look, that's how you make a fantastic impression.
Yeah.
As a new partner to somebody who just handed you over to some of their best clients and said, you cover these cases with some of my best customers. Yeah. Right? Like, this is how you make a fantastic impression on the other people on your team, your new manager. You're like, this is how you do it. Yeah. And that's how you gain credibility in the OR, which is what everybody in this audience is desperate to get. Hey, I just got into med tech. How do I make a good impression? How do I become valuable? How do I show these people I'm legit? Like, come on now.
Literally just got this question today. Just got a text message of, hey, I just broke in 3 months ago. How do I even go talk to new surgeons?
Right on.
How do I not look like a silly goose?
Right. So when I'm working with startup, or when I'm working with entry level, this is one of the things that, like, you have to do this. Please do this.